My name's Rebecca McIntosh and I'm a Senior Dietitian and Project Manager for Cancer Survivorship at Health Ability, a community health service in the Eastern Metro region of Melbourne. And I'm pleased to be presenting today on Health Ability's Good Life Cancer Survivorship program, which supports effective self-management in cancer within a community health setting, and the process we undertook in setting up this program. Cancer survival rates are improving rapidly, we know, due to advances in treatment and earlier detection. People are surviving and living for longer. 72% of new cancers occur in persons aged 60 years and over, and this poses challenges for services to offer disease management support to optimise quality of life, highlighting the importance of follow-up healthcare and of survivorship as part of the cancer care continuum. Coordinated, integrated access to allied health professionals and self-management support interventions underpins quality survivorship care. From the literature, we know that allied health interventions improve quality of life, physical fitness, well-being, mental health, communication, mobility, function, nutritional status, and reduce fatigue and pain in cancer survivors. Frail, older survivors and those who require ongoing treatment require access to more flexible, coordinated and slower stream allied health professional support. Another model of care is required to complement the intensive short-term oncology rehab program approach. With expertise and experience in the delivery of chronic disease management programs, community health services are really well placed to bring together acute and subacute cancer interventions with ongoing community-based support best suited to survivorship care. Good Life Cancer Survivorship has evolved over the last 7 years since its inception. During 2018-2019, there was a pilot program involving our community health service, Health Ability, and Eastern Health, our local acute health service. During 2020 to 2022, with some further funding from the Department of Health as part of the Embed and Spread Cancer Survivorship Program of funding, the Good Life Cancer Survivorship referral pathway that was initially piloted at one community health site was expanded to include an additional 3 community health services. Today, I'm presenting on the process that was undertaken to initially develop the Good Life Cancer Survivorship referral pathway back in 2018-2019, given that's the brief for today's session. So how did we go about doing this? Following the initial project development phase, which did involve key stakeholder engagement and identifying specialist acute cancer service champions, senior hospital exec and the NEMIC service improvement facilitator, there were 3 key phases undertaken. Phase 1, engagement with the VICs and the acute health services and consumers to develop Good Life Cancer Survivorship. Phase 2, which was capacity building of the workforce to support cancer survivors. And the final phase, implementation and evaluation of the community-based survivorship care. So now just to go into a bit more detail on some of those key phases and processes that were undertaken. Good Life Cancer Survivorship pilot in 2018-2019 was a collaborative service development between Health Ability and Eastern Health and their oncology service and NEMICS, with funding provided by the Victorian Government. We gathered the right people around the table. We held regular steering committees. We had specialist acute cancer service champions and senior hospital exec actively involved. And we also had support from staff at NEMICS. So this strong project governance structure really aided us in the setup of Good Life Cancer Survivorship. During the engagement phase, we sought to determine the referral pathway from Eastern Health and a key triage role at Community Health. We formulated drafts of processes and tools, things like the referral form, marketing and communication material, and we periodically sense-checked these with all stakeholders. To help with building the capacity of the workforce, we surveyed community health service staff regarding their learning and training needs to inform the design of professional development packages for staff. We sourced and provided training opportunities, and we in-serviced hospital-based teams on community health service provision. We had regular contact with Eastern Health throughout the program to help aid understanding of services available within community health to support referrals. And there were opportunities for hospital staff to visit the community health service site to really further aid their understanding of service provision. We also attended team and unit meetings, handover meetings. We visited the clinics and day oncology and presented at the oncology ground round. I'll now turn the discussion to the final phase of the project, which was focused on the implementation and the evaluating of the community-based survivorship model of care. And this involved communication and promotion of the referral pathway. Good Life Cancer Survivorship accepts referrals only from Eastern Health Oncology Services, so that's our local acute health service. GPs and other primary care providers are currently outside the scope of this program, but we are considering currently how we can further support these providers in this space. The program targets frail, older cancer survivors who were unable to participate in intensive ambulatory oncology programs. Posters on display in the clinic rooms at Eastern Health provide further details around inclusion and exclusion criteria, which really help identify patients that might be appropriate for community-based allied healthcare interventions. Eastern Health clinicians identify and refer cancer survivors using the referral form, which is located on the Eastern Health intranet site. We also developed a consumer poster, which is on display in the waiting room areas to encourage consumers to start a conversation with their health professional about referral to Good Life Cancer Survivorship. Eastern Health clinicians and the steering committee were also actively involved in refining the inclusion and the exclusion criteria. Survivors referred have completed curative intent cancer treatment or are on a maintenance type therapy, such as hormone or immunotherapy. They need to be ready and able to participate in self-management. And in discussions with our partners, this appears to be the most appropriate cohort, as they're not acutely unwell and in a really good position to engage with us in community health and be able to attend appointments, etc. Cancer survivors attending the service receive an individually tailored suite of services, a personal care plan, and allied health interventions to support them to develop and adopt the skills and strategies needed to better manage their long-term health, so as to live well with a cancer diagnosis and optimise their quality of life. Cancer survivors needed to be willing to travel to the service for allied health interventions. However, since COVID, telehealth consultations are now also available. The Good Life Cancer Survivorship referral form shown here on the right of your screen was developed in conjunction with the Eastern Health staff during the original pilot. It ensures adequate and appropriate information such as the medical history, medications are accompanied by relevant and recent pathology and imaging. The referral pathway is into existing community health chronic disease management programs, and these existing programs offer access to a range of allied health professionals and group programs which people with cancer may benefit from. All patients referred are offered an initial appointment with an integrated care coordinator to help with coordinating and integrating their care needs. A personalised care plan is developed, and there's a staged approach to accessing allied health interventions so as not to overwhelm. Eastern Health clinicians may identify a particular allied health discipline needed, but not always. The integrated care coordination role utilises self-management frameworks and discusses with patients their main health issue or areas of concern. It clarifies knowledge and understanding of their condition and treatment, and discuss lifestyle and behaviour change options with a person-centred approach. Through this assessment, gaps in care and self-management are identified. The nursing or allied health staff member undertaking the integrated care coordination assessment then has a key role in care planning and in the coordination and the delivery of services for the cancer survivor within the community health setting. So these tasks might include things like developing a care plan, initiating internal referrals to allied health, communicating with the acute oncology clinicians and the patient's local GP, and facilitating case conferences. So in summary, Good Life Cancer Survivorship has seen the successful implementation of a multidisciplinary community-based cancer survivorship model of care. Evaluation indicates the model is feasible and appropriate for replication across community health settings. It was acceptable to consumers, clinicians and referrers, and provides relevant and needed allied healthcare services, helping cancer survivors transition from acute treatment to maintenance of health by enabling survivors to feel supported, develop self-management skills and be actively involved in the management of their own health. Providing services within a community health setting, leveraging the existing chronic disease management expertise, provides the basis for an integrated approach to care for an underserved group of cancer survivors. Ongoing training and education was highly valued and effective in building trust between clinicians working across sectors and agencies. Effective communication was key to engaging clinicians and consumers, and there is a need to continue to improve communication between healthcare settings. Connecting pathways of care via key care connection roles has enabled relationships to build across and within settings that are meaningful and localised, support the ongoing awareness raising, education and understanding of services across both the community and acute care setting. Community health remains a valid setting to support cancer survivors, and the core components of this program provide the basis for further implementation across other community health services to improve the accessibility of allied health services for all survivors. And if you're interested in some further details regarding the evaluation, we have published two papers, one on the initial pilot model and then on the subsequent expansion. Thank you. They're my contact details, should there be any further questions.